Hi, this is Dr. Nick, the Incrementalist, and I'm here with incremental steps for a healthier business and life post-COVID-19.
And I'm Fred Goldstein with Accountable Health, and I'm consulting around businesses and what they should be doing around healthcare and adjusting their healthcare systems. So Nick, give us a sense of what's happened. We talked a few weeks ago. A lot has changed in the United States, a lot has changed around the world around the virus. What sort of things are you seeing?
Well, I think the first thing to note is we could have talked yesterday and things would have moved. Everything is moving fast. We're doing our best to keep up and keep people up to date. You're right, Fred, there's lots of new information. A few things from the medical standpoint that I think are relevant that people will be interested to know, will be important. We're certainly starting to understand better what the course of the clinical disease is. I think we're seeing it sort of around day 5 is the point at which you present with symptoms based on first exposure. That's the median, so there are averages around that. And to be clear, the 14-day isolation is absolutely mandatory because we get people that present with the disease later than that. But typically it's around 5 days. The other interesting fact to note for folks is that we're seeing a lot of anosmia or loss of sense of smell as one of the indicators. So if you get that on top of flu-like disease, there's probably a pretty good sense that you may have COVID-19. And then the final thing that I'd say or suggest for employers thinking about this is test, test again, and test again. In the case of Wuhan, China, they were not accepting that a single test or even a third. They went for testing before they would rule out somebody as COVID-19 exposed. And that's because not all of these tests are sensitive enough to pick up the virus. And that's not about the test necessarily. Some of it's about the sampling. We're going to get better, but don't rule it out just based on the fact that you have a negative test. Now, Fred, what's going on in the business world?
Well, just like you, I think one of the key issues is listen to what your leaders are saying, whether it's the federal government, the state government, or your local government. Different areas are responding differently. And that, as you said, changes very rapidly. So both the morning and afternoon are probably good times to check and see what it might be doing to impact your business. Also, I'm seeing issues with people working from home where some individuals still don't understand that their function is not critical and they're going in and showing up at work. And as a leader, you need to explain to them, wait a second, there's really no reason to be here. Your job's safe, you're okay, and get them back out at the house and doing things like that. I also saw a recent article about McDonald's that I thought was fascinating and how they're responding to the COVID virus. So they've decided, they used to, years ago, 5 years ago, apparently they launched that breakfast anytime deal. And they've decided to pull that back. And they pulled it back because they found out it was, one, reducing efficiencies around their services during different times of the day. So by restricting that to the morning, they're more efficient and people show up just for that. And then they also recognize that they've simplified their menu. And by simplifying their menu, they have created a little bit more of a margin in their business. And so if you think about that in any business, if you have a lot of services, maybe you cut those back to the key ones that you offer that people will order and that you have a good margin with so that you can continue to maintain your efficiency.
No, I was just going to say, it's interesting that, you know, there's a service industry like McDonald's that you'd think, wow, you know, completely crushed by this, but they're completely rethinking it. And I think the lesson there that I picked from that is, you know, rethink your business, reorientate to this new environment, expect it to be, this is the new normal. And they've said, we're going to adapt to that. And I think that's a great strategy for others to follow.
Absolutely. And it's also a strategy that can continue on for the longer term. Once you've made that transition, your clients will come with you if you've done that correctly and chosen the right things, and they'll stay with you, which is what you want to survive through this. Get through it so you can come out the other side. I also saw one other really interesting approach. Obviously, Costco and Trader Joe's are lining people up and have a time period for the over 60, and they put on the floor how far you should be standing, etc. But pet supermarkets, I had to bring in, get some food for the dog, and they have 2 people allowed in the front only, and they've taped it off. And there are 2 people working in there, and one of them asks you, what do you want? And they go and get it for you. So you're not walking the aisles, you're not touching stuff, they bring it out, and you go out, they bring another person in. Obviously an efficiency issue, but a very safe way, I would think, to do things like that. And one of the issues I had is you were talking about the testing is what should people do? If you're saying it's 4 tests in Wuhan before you could say a negative, we're still struggling with these number of tests. So how should an individual consider that? First one comes back negative, you feel great, but should you just still continue to self-isolate?
Well, so I think you should be driven by actual personal feelings. So one of the things that we see in clinical medicine is we're guided to discard our stethoscope in this particular instance. Not that the stethoscope and listening to somebody's chest is important, but it's more about looking at the patient and how they are. And I'd say the same thing to individuals. If you feel unwell, then you should be self-isolating, even if your test comes back negative, and you should persist with that for the minimum period to make sure that you're not infected and, importantly, infecting other people. So be driven by your own sort of personal experience and support your employees in that fashion so that they can do that and be safe and feel secure that that's the right move and that they're supported to do that.
And let me ask you this, somebody then goes out to a store, they buy their groceries, they come home. Is that a reset for that 14 days or not?
When you say a reset in terms of isolation?
Yes.
Well, quite frankly, if you're in isolation, you shouldn't be going out to the store, let's be clear.
Okay.
So I think, you know, in those instances, that's one of the areas that we as a community need to help those folks, both the elderly and the people that are more at risk, immunosuppressed, helping them by going and getting their groceries so that they don't have to go out. But if you're somebody that's self-isolating, you need support from others to be able to get you the goods and the materials, the foodstuffs and so forth, so that you don't go out. There should be no reset. There should be no break to that isolation.
And so that self-isolation is triggered by what?
Well, it's
a symptom?
Any instance of exposure, potential exposure to people, or importantly, symptoms. Although symptoms we know are late on in the disease process, it's really a question of have you been exposed and therefore should you be isolated or are you at risk?
Right. So if there's no known exposure, then it's okay to sort of go to a store, but still watch what you're doing, maintain your distance, etc. But if you have some instance where there was a potential exposure, then you isolate and then keep yourself from going anywhere for 14 days.
Yeah, and importantly, people reference this as social distancing. I think the preferred term, certainly for me mentally, is physical distancing. I'm not socially isolating myself. I'm physically isolating myself. I'm using these technologies to engage with people, and I'm still communicating with somebody in the store. I'm just being physically distant because that's our best mechanism for preventing the spread, reducing the impact, and reducing the horrific numbers of deaths that we're currently projecting or may potentially see just in the United States.
Right. Fascinating issue. And I know as I've gone to the stores, et cetera, it's always, I'm standing further back than I used to. I know now they're really talking about putting markers in the store to keep people certain physical distance apart. And hopefully people pay attention to that. I know a lot of people I've been watching, there are marks on the ground, but they're standing right over somebody's shoulders. And it's just a matter of getting people better educated and understanding this is a real issue.
Pay attention to the guidance. This is not a hoax. This is not some conspiracy. This is real, folks. We're seeing the impact. We're seeing it, and it will spread throughout if we don't follow the guidance, as you said, Fred, from the folks at the state, government, federal levels.
Yeah. Well, fantastic. A great update, Nick. As always, a pleasure. We'll be doing this again soon.
Likewise. Well, I'm Dr. Nick, the Incrementalist, and I'm here with incremental steps to help you for a healthier business and a healthier life post-COVID-19.
And I'm Fred Goldstein with Accountable Health, and we thank you for joining us.